One of our outstanding chief residents as well, whom I'm very proud of, will talk to us today about his journey with scalpels and solos, music, medicine, and the making of a surgeon. Dr. Lane has graduated from has completed the Bachelor of Arts in Biology from Hastings College, and then earned his doctorate in medicine from University of Nebraska Medical Center, and has earned many awards throughout his tenure here at Creighton in the Department of Surgery, presented nationally as well in various aspects of ENT, general surgery. We're quite blessed and fortunate to retain Dr. Lane to serve as the trauma medical director at Mercy Council Bluffs, and he's getting his hand off as we speak from Dr. Akar. He'll have a general surgery practice in that area, which is an important and strategic area for CHI. I appreciate and thank Jeff Wooten, our Chief Recruitment Officer for the system and for surgery, who's been integral for this recruit. And I know you're going to crush it there. What I'm impressed about Sebastian, his ability to connect with people, his humility, and two skills that are very important for us as human beings, and I think is very important for surgeons as well. That's what keeps patients safe, keeps them happy, and to lead to meaningful relationship between us and our community as well. Sebastian, I'm very proud of you. Looking forward to your grand rounds. Thank
Thank
you.
you, Dr. Arfai. Perfect. All right. Hopefully, we don't have any technical difficulties, have some videos and things like that. But again, my name is Sebastian Lane. I'm one of our chief residents, and I'm really excited to be here presenting my grand rounds, scalpels, and solos, music, medicine, and the making of a surgeon. So, this talk really is deeply personal to me. In many ways, it's the story for me of the two worlds that I've experienced growing up that have always existed side by side in my life, both music and medicine. I grew up in a musical family, as a lot of you probably know, and many of the students and other faculty may not be as familiar, but my grandfather was Jimmy Rogers. He was one of the legendary blues guitarists and singers who was known to be playing alongside Muddy Waters during the rise of the Chicago blues scene. So from an early age, music wasn't just entertainment for me or in my home. It really was identity. It was storytelling. It was culture, connection, and ultimately it was survival. I grew up around guitars, amplifiers, smoky blues clubs with my dad, old records, and musicians telling stories through music in a way that words alone never really could. I was exposed to people like Eric Clapton and Mick Jagger at a young age, not even knowing who I was around, but now can appreciate how special those moments were at such a young age. But I chose to follow my own path while continuing to play music throughout my life, even during medical school on the weekends, sometimes flying out to different cities, and much less often now during surgical residency training. All these experiences really did shape who I am. My grandfather actually eventually passed away from colon cancer, and watching someone who to me was really larger than life dwindle away so quickly and succumb to a diagnosis that was really completely foreign to myself and to my family at that time was something that really carved the path for me and is what motivated me to pursue a career in surgery. So for much of my life, I felt like I was walking these two parallel roads, one towards music, one towards medicine. And what I eventually realized from that was that after much inner turmoil and advice from many different mentors on pursuing one path versus the other, lots of times people telling me to put down the guitar, I realized that music and medicine really have been intertwined for as long as we've really been around. So before anesthesia, before operating rooms and evidence-based medicine, humans use rhythms, chants, drums, and it really started back in the day in the beginning of the Bible in ancient Greece, Chinese medicine, indigenous ritual practices, and cultures throughout history. So that's what I'm going to be talking to you guys about today. Um, Today we're going to trace those histories together. We'll walk through the origins of blues music. Oops, sorry. We'll walk through the origins of blues music and talk about artists like Robert Johnson, my grandfather Jimmy Rogers, Muddy Waters. We'll explore those relationships deeply. We'll look at a review of history and culture and music and medicine and surgery, evaluate the evidence for intraoperative and postoperative effects of music, and provide some practical evidence-based recommendations and safe implementation of music in the clinical setting. I do have a couple of disclosures. They shouldn't be pertinent really for this talk, but I do have sponsorships with Teton Guitars, Callum Bread, Sinusoid Cables, and Stage Clicks, but these are my own views and not theirs. And I wanted to start off, if you guys are able to still scan this code, I just wanted to do a quick survey of the audience for a little bit of early audience participation. So, all right, so we'll skip that. I just had some questions, just wanted to kind of get an idea. So maybe just like with a show of hands, how many people enjoy listening to music in the OR? Okay. How about, does anyone prefer not to have any music playing at all when they're operating? Okay. Let me pick on Dr. Balters. What kind of music do you like to listen to in the OR? Okay. And that was one of the other questions I had was who generally picks Dr. McNamara in your OR? Do you usually pick the playlist or are you usually letting Lisa pick the playlist? Uh, that's not true. That's not true, not true. But that is hilarious. Okay. Well, that's funny. All right, Dr. Patel, do you think that we have any of rules or regulations in Bergen Mercy Hospital System on whether we can or should play music in the OR or while patients are awake? Okay. And then Dr. Arfai, just based before we talk about anything further, do you believe that music has any impact on, patient outcomes?
Um, I think there's literature in the cancer world that art and music influence their perception and therefore from a quality of life. I can't speak for outcomes for
Yeah.
that. Yeah.
Okay. Have you implemented in your own practice the use of music in any way?
I enjoy music in the operating room, not loud music,
Hmm.
just any type of music in background.
Okay.
Yeah. Yeah.
Well, I find all these to be kind of interesting thoughts. They're things that we kind of think about philosophically when we're operating. We kind of talk about, volume, and some of that seems to be kind of intuitive. And we'll kind of get a little bit into the data of that a little bit later on in my presentation. But, I kind of bring this all together, say why this talk. Of course, it's personal to me, but I think music, like we've seen, basically everyone raised their hand. Music is ubiquitous in the OR, but we really have little formal training on its use. I think that there's potentially an impact on surgeon performance, team dynamics, and patient outcomes that until more recently really wasn't studied deeply. And I think at the end of the day, art is what makes us human and kind of connects all of Creighton's core values. A little bit about me, like Dr. McNamara mentioned, we like to play my music in the OR, but no. So just to talk a little bit about some of my history. So I grew up playing music, like I said, touring around the world, really, and I've had amazing opportunities to connect with different artists and people. Have had the opportunity to tour with like Darius Rucker when I was in medical school, play with different artists like Chris Stone Kingfish and Eric Gales, who to you guys, some of you may not know their names, but big blues guys. They are actually just on the Oscars playing for their role in the movie The Sinners, where they did a lot of the soundtrack for that movie. So I've had so many amazing opportunities, and I've done the best I can to kind of balance that throughout my journey. And it really just traces back to my roots. So the roots of blues music goes back to West Africa, where music traditions in America through the transatlantic slave trade brought them to America. The enslaved Africans carried with them a rich musical culture where they really emphasize rhythm, improvisation, emotional skills, percussion, and call and response singing. In many West African traditions, music was not separated from daily life. They rather incorporated it into labor, spirituality, mourning, celebration, and community identity. Even under slavery, those traditions survived and they actually adopted them into practice. So during the antebellum period and throughout the pre-Civil War era, these enslaved individuals would use music in multiple ways. So they would use it to help communicate. They would use it for their form of worship and for emotional release while they had long, hard days working. In this environment is what emerged, what we refer to as spirituals and work songs or field hollers, which is very kind of an interesting practice. So field hollers, what those are is where essentially it's a flowing type of music where it's like a singing in character where they tell a short story that's repeated over and over again. And then it kind of goes into almost this yodeling type of response that traces back to rural tribes in Africa. Um, they would come up with new songs and incorporate them into spirituals, and they would meet in secret groups where they would sing and dance and they would eventually kind of break out into a frenzy and sometimes speak in tongues. So this was kind of the base ideology of where blues and the even the current music that we listen to now and pop music that you'll see really originated. The work music back in the fields and the mills and factories and farms, these went singing hand in hand. So even the masters at that time would encourage the slaves to sing because it would make them more efficient with repetitive jobs and keep them in time while they were working. Um, they had to be creative. So out of this and not really having access to a ton of materials, they would invent new instruments. So one of the earliest instruments that they came up with that traces back to things like the lyre that I'll talk about when we get to the Bible. But they would string a metal string if they could find a metal wire, and they would put it up against a wall or a board. And this is where they came up with what's called the diddley bow. So during these secret meetings, they would kind of put their instruments together and come up with ways to make sound. So they would use glass bottles or anything else that they could do, and that's really where like the slide guitar found its origin, or the basic banjo was invented that came from an African instrument called the goji. Um, as we kind of advance forward, this photo captures a group of Civil War soldiers, of African American soldiers, camped out overnight. And so, as many of you know, the Civil War was one of the first wars that was really photographed and documented. So there's lots of interesting photos, and this one captures some soldiers as they gather to play cards, sing music, and use instruments to kind of get rid of some of the stress from a long, hard day. Um, Publishers, they would supply these troops on both sides with a variety of books called songsters. And these books included lyrics, dozens of popular songs at that time, and different lighthearted jingles. So this kind of pushed that progress along to get more gathering and spread of that culture from the Deep South. This is what ultimately, after the Civil War, led to the birth of the blues. Its origin is in the Mississippi Delta. And this figure, Robert Johnson, was played a pivotal key role. Many historians describe blues as one of the first truly personal forms of American music. There were many early pioneers. So as blues music evolved through the earliest 20th century, a group of pioneering musicians, Robert Johnson, Charlie Patton, Son House, Blind Lemon Jefferson, who is pictured here, they were not formally trained artists. They never took lessons or had any sort of that sense, but they were self-taught, lived in poverty, and they learned playing through juke joints on the street and corners at the plantations, and they would travel throughout the South region to perform. Despite limited resources, they created an entire musical language that would later influence rock and roll, jazz, soul, country, and pop music. One of the most famous artists, like I mentioned, Robert Johnson from that last slide, he's also perhaps one of the more like mythologized artists. Some of you may have heard his story, but he had only recorded a very small volume of songs before he ended up dying at the age of 27. But his guitar influenced most all guitar players that kind of took over after him. He was very rhythmic, had this finger style guitar playing where he would kind of beat on the drum of the acoustic guitar, and people hadn't really heard that before. He became mythologized for his legend surrounding how he had sold his soul at the crossroads to the devil. So one story goes, he met the devil at the crossroads, this tall man, told him that he would do anything to be able to play the guitar well, and that night he sold his soul, and that's what gave him his talent. There were many other founders like Charlie Patton, and just for the interest of time, I'll kind of skip forward through some of these. But that then takes us to what ended up spreading music throughout the country. So to really understand how blues evolved, we have to understand the bigger picture, right? So this takes us to the Great Migration. Between roughly 1916, 17, up to 1970, millions of African Americans, they left the rural South and migrated north to cities like Chicago, where I was born and where my grandfather moved, Detroit, St. Louis, New York, all in search of new opportunities and to escape the violence and oppression of Jim Crow South. So importantly, they didn't just bring their suitcases with them, they brought culture and stories, and they brought music. Yeah. So you can see down here that my grandfather, he actually was born in Ruleville, Mississippi. And this is one of the plaques that the Mississippi Blues Commission put up in Ruleville, where it reads, "Born James A. Lane at Doherty Bayou, just west of Ruleville, guitarist and vocalist Jimmy Rogers played a pioneering role in the post-World War II Chicago blues scene. Member of Muddy Waters Band in Chicago, Rogers recorded the blues standards That's All Right, Chicago Bound, and Walking by Myself. Ruleville's row of juke joints on Front Street, known locally as Greasy Street, and made the town a longtime center for blues activity." So my grandfather was one of those folks that moved up north with his family to Chicago. And this is a map that kind of captures the 1930s layout of Chicago and kind of highlights the segregation that was present at that time. So you can see this is the south side of Chicago, and I put a little star in Inglewood right here, where later in 1992, where I was born and grew up and moved after my grandfather passed away. They ended up honoring him and renamed Honorer Street, where we lived, into Jimmy Rogers Street. And it just kind of demonstrated the impact that he had during the birth of the Chicago blues. So this kind of brings us forward to the 1940s and 50s, where blues had fully arrived to cities like Chicago. The sound began to transform dramatically, and what was formerly an acoustic Delta blues tradition transformed into these loud, crowded clubs, busy streets, and packed dance halls. Musicians began electrifying their instruments, and there's a fun video that I'll kind of show here next on an interview on the Tonight Show, where my grandfather talks about how they began to electrify music originally back in the 1940s. This was the birth of, like I said, the Chicago blues, where sound became sharper, heavier, more energetic, and danceable, kind of still tracing back to the original roots of those founders. They still kept themes of struggle, resilience, love, hardship, loyalty, but encompassed it into that underground roots of the slave trade. So there's an interview on the Late Show where he basically talks about the foundation of guitar and how originally they were playing in acoustic clubs and no one could hear them. So they took some flights down to south of Memphis and met up with some of their friends who started using microphones at the time for the vocalists, and they would put them into the holes of the acoustic guitar to amplify the mic. So they brought that back to Chicago, and then that's where you have people like Leo Fender and Gibson, where they started to come up with the magnets for the pickups and designed electric guitars. And then people like Fender and Gibson gave these artists their guitars to then use and start playing rock and roll. So like I've already kind of mentioned, my grandfather began to play a pivotal role just like in developing that sound. And those songs, after he got signed to a record label called Chess Records, ended up getting published worldwide. And then that's where you have artists like Mick Jagger and the Rolling Stones get access to their records. And they actually had listened to his song called "Like a Rolling Stone," which he recorded with Muddy Waters, and named their band the Rolling Stones. And then other people like Bruce Willis, he got all sorts of met all sorts of interesting and fun people. And I'm pretty sure Bruce Willis still stole that hat. I really would like that back. But I don't know if that's ever going to happen. But yeah, so obviously made a tremendous impact. Does anyone know who this guy is? Okay. Stevie Ray Vaughan. So Stevie Ray Vaughan was a gentleman who was also very pivotal in transforming that blues music into rock and roll and eventually into pop and what we listen to now on the radio ultimately. This is a photo backstage at a club in Austin, Texas called Antone's, which was one of the kind of like legendary blues clubs that helped continue to pass and preserve blues music. And it still does. They still have a lot of blues artists that play there, and it's now owned after Clifford Antone passed away by another artist named Gary Clark Jr. But Stevie Ray Vaughan's noted to have studied all the great Chicago blues players obsessively. You can hear in his music and playing the direct influence and phrasing, the rhythm, his big bends and tone, and attack on the guitar, all the influence from people like my grandfather, who he would reference all the time. That style became foundational, like I said, for other countless guitarists in the like rock and roll scene, and as you get into the 80s, pop music, and then all the metal players, Van Halen, all these artists started to draw from them. So the blues tradition continued to survive. Nowadays, blues music isn't as popularized or listened to as frequently, but all those roots still kind of trace back to the origin. So like I had mentioned, in 1997, my grandfather ended up passing away from colon cancer, but just wanted to kind of just highlight his legacy and kind of why this inspires me to go back to what motivates me to do medicine. So where does the medicine all come into this? For that, we have to go back again in time to the beginning, the Bible. One of the earliest references to music as healing actually comes from the Bible. In the book of Samuel, King Saul is described as being overcome by this intense emotional evil spirit, where Saul's servants then recommend getting therapy for music. They recommend calling in a skilled harp player to soothe him. That musician ended up being David, who would later become King David. In the book of Samuel, we find the passage whenever the Spirit from God came on Saul, David would take up his lyre and play. Then relief would come to Saul. He would feel better, and the evil spirit would leave him. I think the thing that's remarkable about this story and why it's relevant is it's one of the first documented instances of using music as therapy, music to calm the mind, to change emotion, reduce stress, and alter the internal human experience. This increasingly became observed, and we see that trend continue through time. So, as we move into ancient Greece and ancient Rome, the biblical references become influential to thinkers like Plato and Aristotle. For Plato, music was not simply entertainment. He believed that music had a profound influence over the human soul, over human behavior, morality, education, and even the structure of society itself. One of his famous quotes is, "Music is moral law. It gives a soul to the universe, wings to the mind, flight to the imagination, and a charm to the sadness and everything in life." Plato and many other Greek philosophers, they became very curious about the power that music could possess and ways that they could use that to help people and help disease and suffering and emotional disturbances. This, although they didn't have any randomized control studies or anything like that, they began to start to implement this obviously very early on. In other parts of the world, simultaneously, other people were thinking the same way. So this is Confucius, or a picture of a depiction of Confucius, who lived around 551 to 479 BC. Confucius believed that music had profound effects both on individual and also society as a whole. To him, music was not simply art or entertainment, but a force that was capable of shaping morality, emotions, and inner harmony. In Confucian philosophy, proper music was thought to cultivate discipline and compassion, where disorderly or chaotic music would actually contribute to imbalance or unrest. In ancient Chinese medicine, they would emphasize that balance within the body, and particularly between opposing and interconnected forces like yin and yang, which I'm sure you guys have heard of. And then these five tones of the organ system were important for balance. So they looked and actually identified and associated different sounds and instruments with different organs. So the Ji was associated with the heart, the Shang was associated with the lungs, the Ju was associated with the liver. The gong was with the spleen and earth, and then the yu was kidneys and water. As you continue to move forward in time to the medieval period, the relationship continues between music and medicine, and it continues to evolve. During this time, much of medicine in Europe was still based on the theory of the four humors. So blood, phlegm, yellow bile, and black bile at that time. And health was believed to be dependent on the balance of these humors and maintaining these humors. Interestingly enough, music was something that was prescribed sometimes as a part of restoring that balance at that time. Different types of music were believed to influence mood, temperament, sleep, spirituality, emotional well-being, and could calm excessive passion, relieve melancholy, or ease emotional distress. So you can see the theme that a lot of this at the time is just based on more so like psychological treatment and rather than physical treatment. But they still believed at that time that it was a balancing of the humors. This is one of the texts from the time, the anatomy of melancholy, that directly referenced and documented this exact belief as a way to heal. It was see, yeah, the one important figure, it was Robert Burton who wrote this, and this was his book, like I said, The Anatomy of Melancholy, where they discussed that music as a treatment for depression and emotional suffering. He wrote about music's ability to lift mood, reduce sorrow, and influence mental illness. As we continue to progress along into the 1700s and 1800s, during what we refer to as the Enlightenment period, early medical era physicians and scholars began to try to actually study and learn what these effects were more systemically. Medicine was beginning to ask not just whether or not it affected people, we kind of understood that it did, but how did this occur? And one of the earliest American references to that would what we now refer to as musical therapy or music therapy appeared in 1789 in the Columbian magazine. And throughout the 1800s, medical dissertations and physician writings increasingly discuss music's therapeutic value in treating illness and emotional suffering. In that period of time, we see the first times where music is being discussed in a true clinical context rather than a philosophical one. In particular, one important figure was Benjamin Rush. He was not only a signer of the Declaration of Independence, but also one of the early pioneers of American psychiatry. He formally suggested that music could be used therapeutically in the treatment of mental illness and emotional disturbances at a time when psychiatry care was still pretty primitive and inhumane, as many of you are very aware of. He believed that music could influence our nervous system to help regulate emotion and help restore mental balance, which we find now to be very true. At this time, we found that institutions began experimenting with music in medical settings. So there was a place called Blackwell's Island where music was beginning to be introduced into patient care environment, while physicians explored whether music could influence healing. As we enter the 20th century, that relationship continues to change, progress, and become even less philosophical and more observational and experimental. It marks the beginning of modern music medicine in hospitals. So during the early 1900s, physicians, nurses, and musicians and educators increasingly observed that music seemed to improve patient morale, reduce stress, create calmer healing environments. And importantly, these observations began leading to organized professional programs and efforts. So in 1903, the National Society of Musical Therapeutics was formed, one of the earliest attempts to kind of formally organize a group that recognizes music as therapy. And then a couple decades later, in 1926, the National Association for Music in Hospitals was established. And this reflected an ongoing growing interest in music directly being incorporated into hospital environments. As we continue to move forward into 1941, so overlapping, this is kind of around the same time where my grandfather had moved to Chicago and was starting the Chicago blues scene. The National Foundation of Music Therapy was created, which helped lay down the foundation for music therapy as emerging healthcare profession. And historically, the timing was really, really important because in the early and mid 1900s is when medical transformation was really progressing pretty rapidly, where we kind of get the idea of modern hospitals and what those look like. Surgical techniques were continuing to advance pretty rapidly, and the field of psychiatry was evolving and becoming increasingly scientific at that time. As we move more towards the modern times, musicians and physicians and nurses were observed to find even more data based into the World War I and World War II, where they would perform in front of the soldiers. The U.S. government actually recognized this as well, and they would put on what we know as the USO shows, where they would get some of the famous pop artists at that time, and they would send them to play for the troops to help boost morale at very difficult times. Some of the iconic performers at these U.S. shows were stars like Bob Hope, Frank Sinatra, Judy Garland, Lucille Ball, Jack Benny, and Mickey Rooney. And that kind of brings us up until now as things continue to evolve. By the mid 20th century, universities began establishing structured training programs for musical therapy, and hospitals increasingly incorporate music into psychiatric care, rehab settings, pediatric care, and chronic illness management. At the same time, medicine itself was becoming more and more scientific. We had advancements, as you guys are aware of, in antibiotics, modern medicine, ICUs, advanced surgical techniques, and everything was rapidly transforming. So music, something that seems a little bit more philosophical, was easily kind of put back a little bit into the back of our minds. We, however, got advancements in imaging techniques. So, for instance, the functional MRI, we were able to image the brain, and neuroscience research further showed that music actually activates widespread brain networks that are involved in reward, memory, emotion, attention, and autonomic regulation. Has anyone ever seen the show, the like documentary Alive Inside? You guys familiar with that? Anyone? So there's some fun. I encourage you guys to look into this one. It was actually some interesting research on Alzheimer's and dementia patients, where they would play music to someone that, for instance, had no cognitive function. They were in a nursing home. They were nonverbal, and they would put headphones on them and play a song that their family would recommend they'd be familiar with, and you could see them kind of awaken. Their eyes would open, and a lot of times they would start singing. And the thing that was even more fascinating about this was that after they took the music off, they would ask them like some yes or no type questions, and they were able to like answer the questions before when they had been completely nonverbal. So I'd encourage you to go look that up. Um, and one of the landmark studies that demonstrated the impact on music and medicine that we start to refer to now came out in 2015, where it was a systematic review, meta-analysis that looked at over 73 studies, involved almost 7,000 patients, where they reviewed music interventions and found that the association was actually pretty stark, that improved postoperative outcomes. And something that was really fascinating to me, it really didn't matter when the music was played. Even when music was played intraoperatively, they noticed improvement in patient outcomes, and most of those outcomes in the data is related to anxiety postoperatively, post-op pain. So they noticed a reduction in opioid use postoperatively, and then kind of like stress even in pre-op. This is a forest plot that kind of shows that. So it's kind of, obviously you can't see it very well, apologize for that. But pain scores, overall analgesia use, overall anxiety, timing of music delivery. So this here shows whether it was given pre-op, intra-op, or post-op, and everything favors the music side. Timing of music delivery, like I said, and then general anesthesia versus no general anesthesia. And as you can see, none of it falls onto the side favoring music. And then here it's kind of flipped around. It's patient satisfaction. So the patients were all happier when they got music. Um, I know I'm kind of coming short on time, so I'll kind of just highlight some of this. But modern neuroscience, like I've mentioned, it continued to demonstrate the pathophysiology on how this actually affects us. We know that one major region of the brain is the limbic system, which plays a central role in emotion, memory, and emotional processing. And that is why music can immediately trigger emotional responses. So I'm sure all of you are pretty familiar with that. You hear like an old song that you haven't heard in a while, and you feel, oftentimes you can feel very strong emotions. Um, it activates many of the same processes that we get for our reward centers involved in pleasure, motivation, and positive emotional reinforcement. The neurochemical response helps explain why music can feel emotionally powerful, motivating, and comforting at times. Um, we tried to understand, how is it that music can have this impact on pain, reduction in stress, and so there's a bunch of different theories behind this. One is a landmark concept that actually originated out of the 1960s called the gate control theory, which some of you may be familiar with. But the theory kind of proposes that pain signals are regulated or gated within the spinal cord at the dorsal horn, and in simplified terms, basically, the gate can either be open, which allows the pain signals to travel through, or the gates can be closed, which reduces or suppresses pain perception. So in that theory, music actually is believed to be one of the ways to close the gate, because it can be distracting, and it can also release endorphins, like pleasure hormones. So there's a bunch of different things that we now understand to why it is that we believe music can impact pain in post-surgical settings. And it actually became the framework to develop things like the multimodal pain regimen, TENS units, spinal cord stimulators, and music-based interventions. So what type of music? We kind of talked on this at the beginning. That's why I was kind of asking some of these questions, like, do you want to listen to rock and roll, country, pop? This is just a fun AI generated diagram that shows just how many genres and subgenres there are of music. And when we go to like submit a record, it's kind of funny when you click down, they have you submit the genre, and there's a tab that populates down, and it's like millions of different genres that you can choose from. But which one is the best? I think the most studied is classical music. It's the most heavily studied genre. What we commonly find in the literature for classical music is that it does reduce preoperative anxiety. It reduces sympathetic activation, heart rate, and blood pressure, and it improves calmness. It sometimes can also decrease the analgesic requirements. Characteristics of the classical music is the slower tempo between about 60 to 80 BPM, and then a low dynamic variability. So they're not lots of highs and lows, but pretty consistent kind of cadence. Frequently used examples of artists that they research are like Mozart and Bach. And there's a 2024 perioperative study that specifically compared classical music with patient-preferred music during hernia repair, and they found improvements in anxiety and recovery with both interventions. And that one wasn't really favored. So increasingly today, as you guys are aware, it's like patient-centered care. So patient-preferred music has become increasingly supported also in the literature. There are stronger evidence that support reduction in anxiety, improve satisfaction of patient scores, better emotional comfort, improve hemodynamic stability in some papers, and improve quality of recovery scores. There's recent randomized trials that show in orthopedic surgery specifically under spinal anesthesia, it showed that patient-selected music again improved in all of these areas. So there's a conceptual shift right now on is there room for more research on patient-centered music, and how can we implement that into practice? Again, some more things like on ambient music. As you guys know, sometimes out in the foyer we'll have artists playing the piano or guitar, and I think all of you can appreciate, you notice it. Sometimes you may not notice it when you're walking by, but you may kind of feel a little bit more relaxed when you walk by, or at least I do. And then how about here? We've all been in the ortho room where they're blasting Dr. Balters and Matt Riley's favorite genre, some heavy metal. But this is kind of where the outcomes become mixed. They do show that there's potentially some negative impacts with impaired communication, obviously, some distraction, reduced speech perception, and an increased cognitive load, because you're kind of balancing high volume, fast tempo, and lyrically dense type music. There was a major systemic review on surgeon performance, and it concluded that loud or high beat music can become distracting and actually negatively influence technical or communication performance. So what we really care about, and I apologize that we're kind of coming up to the end, but what we really care about is, how can we get better? Does it actually help us? And there are many studies actually that support it, that music does improve mood, reduces stress, you can have better perceived focus, and you can have improved flow state, which is something that I found interesting, because when I'm playing a show, I am very familiar with what flow state, and it's kind of hard to really describe. But when like some of those pictures earlier, when I was playing on stage with Darius Rucker, half of those shows, I do not even remember the performance, to be honest, because I just go out there and I'm kind of on autopilot in that flow state and just kind of in the moment, and then like afterwards don't even recall. And so I think a lot of times I can actually transpose that into the OR when we're doing a case that you're very familiar with. Obviously, you're paying like close attention if you're doing a gallbladder, but you're still just kind of going on autopilot, like all right, I got to get the critical view. I have to do this dissection. I'm looking out for X, Y, Z. So I think there's a lot of translation there. There was an article by the International Journal of Surgery where they showed the influence of music on surgical task performance specifically, and they found that music may improve surgeon performance, and again reiterated that loud and high beat music actually can be detrimental, so that if you're choosing your music more selectively, it can actually improve your skills. I'll probably just pass through this for the interest of time, but there was a really good section that the American College of Surgeons actually published fairly recently that goes into it, and they interviewed 4 different surgeons. So I will play this.
Music has been a part of healing and the culture of medicine since the beginning of our cultural history.
music has become, it's become an ingredient. It's become part of my, my DNA. So I've been able to try to adapt a lot of, what I've learned about music to surgery. And so for me, it's become more than just an avenue for balance. It's also, I've been able to apply things in music to the practice of surgery, which people have found quite interesting.
I think that's a common theme among surgeons and many physicians, is it creative sides of their brain, and whether that outlet is purely in the space at work, or whether they're a painter, or they're a songwriter, or whatever. These things all come together. There's so many artists who of different stripes, that have become surgeons or interventionalists.
I mean, there's no question that even at this stage where I'm a relatively senior surgeon, the more I practice, the more relaxed I am, the more sensitive my fingers are to the feedback tissue gives you when operating. And that still holds true today. And I practice more. I Monday surgery, I will use the weekend to practice more to be ready on Monday for a big surgery.
Time dilation, where you're simultaneously controlling both your hands and reading the music and listening to multiple other people and responding to them. I think particularly in a complex surgery, when something does not go as planned, I would say that those skills, like when things go wrong in music and you're simultaneously doing that, that's like when things are tense in the operating.
Do you have to be a musician? No. Does it help? Yes. Are there important concepts that anybody can learn from musician? Yes, I do think so. And now that I'm a teacher to many trainees, residents, and fellows and so forth, I pass on those concepts.
So to conclude, I think across 2,500 years or more, we've just been able to appreciate that medicine repeatedly returns to that idea that healing, it's not just merely biochemical, it's sensory, it's emotional, it's neurologic, and ultimately it's profoundly human. So I think that for us, being able to kind of take a step back and reconnect with the human as a whole is important. And it's something that I've really tried to do in my practice and even just personally. And so I think music can heal all, and sometimes it can just take a song. And like you guys know, at the end of my M&Ms, I usually put pictures of Sloan. So this song, or it's not, I guess, a song, but I just think it's a cute video that shows.
And maybe it's a party talking or the chocolate fondue. But with you, I hold my peace, and it's not like I've ever known before. Love's an open door.
Get there.
Love's an open door. With you. Love's an open door.
Yeah, girl.
So with that, I'll take any questions, and thank you guys for your time.
Thank you so much, Dr. Lane. This is wonderful. Appreciate you sharing your journey, and I know you're very proud of your grandfather, and educating all of us about the history of music in America and how it intersects with surgery and patient care. Questions for Dr. Lane?
John?
Yeah.
Thank you, Sebastian. I do think, as someone who's also into a lot of different music fields, I think it's a really cool topic, and a good place to keep in mind that we keep all these other personalities to ourselves, and as we grow professionally, it adds a lot of value to your life to have this involvement. So I have one thing to plug: is that for any students, residents, or attendings who want to cultivate their own musical outlet, there is a Nebraska Medical Orchestra in town. They accept everyone in healthcare: Creighton, UNMC, Boys Town. No audition process. There's performances you can be a part of. They do that twice a year. I was part of that very closely in medical school, and even though your time commitments are likely to change throughout your career, I do think that being part of that was really great to remind myself that I have this musical outlet, and I think I gained a lot of value in having that.
Yeah, thank you, John.
Wow, that was a wonderful talk. Thank you. Thank you very much. As you were talking about the blues emerging from hardship and displacement and resilience, I was thinking about our surgical residencies and how medicine similarly develops cultural traditions in response to suffering and stress. And maybe you can comment on that.
Yeah, I think there's a direct actual translation there. I think in surgery, it's culture, right? And passing on tradition. So I think one thing I reflected on is, we have literature we can read. I didn't train playing guitar, reading music. I learned by ear and from being passed down information from my dad and my grandfather. And I think that kind of directly translates into residency. We read books and learn techniques, and then we go to the OR. And the way that Dr. McNamara closes this is different than the way that Dr. Alfai closes this. And you can take different techniques and strategies and form them into who you are. And I think similarly, music kind of evolves in the same way, where it's like, all right, I listen to Stevie Ray Vaughan and I listen to Eric Clapton and I listen to my dad and all this, and I take these little techniques and then I can make it my own. And it kind of progresses and changes that culture over time to just get better and better. And that's kind of what leads to, transforming medicine, transforming surgery, transforming music. Now we have AI. And I've talked to some of my colleagues and stuff about this. With AI, you can generate a song with a prompt in 10 seconds. Now we're learning, you can have AI in the OR and looking at colonoscopies and not missing lesions. I think it's all kind of like just an interesting parallel of just human experience, to be honest.
Dr. Akar?
First, speaking about AI, did you generate those images, those really cool images of bands playing in the OR?
Yeah, so what I did was I kind of had a pre-slide template where I wrote all the information that I wanted it to do and organized it. And then I kind of put them off into an AI generator. So hey, can you come up with a background for a bunch of surgeons listening to a rock and roll concert and blah, 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 blah. So
that is pretty cool. I would love to get a copy of those if you ever feel like sharing. That was an excellent talk, and obviously a difficult subject to tame. And you did a great job in sort of taming it and bringing focus to the background, the history, and then the modern era. There are two, you talked a little bit about the ancient Greek period. There are two Greek gods under the mythology that were associated with music. Do you know who those were? So one I'll give you, and then you'll say, oh yeah, I should have known that one, is Apollo, who is known as the god of music and medicine, right? The other is Dionysus, who was a Greek god of sort of attributed to wine, women, and song. But under the Apollonian tradition, music is rhythmic, structured, almost mathematical. The Dionysian culture would be melodic, loose, syncopated, and so on and so forth. And those two dimensions obviously complement each other, along with the third dimension of music, which is, of course, harmony, right? Rhythm, harmony, and melody. So that's something just I wanted to throw out.
Yeah, there's a ton of amazing theories, and when you break down music theory into all of that, it's all fascinating because ultimately it's kind of just it's mathematics and numbers. We have different choral structures, and you've heard of the circle of fifths and that kind of thing. So yeah, it's all fascinating.
Other questions for Sebastian from Zoom or in person? Dr. Pepinas.
I was always impressed that music remains effective even in patients who are profoundly limited because of advanced neurological disease. And as you were talking, I was thinking, and maybe you can tell us a little more, that music is one of those inputs that simultaneously recruits many things like emotional and cognitive and reward and memory circuitries. and maybe that's how it remains so effective. What please let us know.
Yeah, that's exactly right. So from my research, and I was kind of trying to highlight it in that slide where it showed the MRI. What they show is that even in a brain that's atrophied, there's so many connections that go about when you listen to a song, or especially in musicians in particular, where you're playing music, tapping your foot, listening to the beat, connecting with other people, associating with an emotion, a memory, a time, a smell even. So that's something that I do actually when I'm playing shows. I light like an incense, and it's for me and a lot of people when they've come to my shows. They're like, I remember like you had this thing, but it's like memory that gets ingrained. And so I think that's ultimately what it boils down to. So like that, I would encourage you to go look up that show. I think it's called Alive Inside, and there's a couple of news clips and things like that, but it talks exactly about that. Someone with advanced Alzheimer's disease that was not nonverbal, they played the music and it's able to, I don't understand how, but it connects all these different pathways to then bring back a little bit of that person that might still be in there. So yeah.
Dr. Lane, as we bring closure to this wonderful grand round, and you're coming to the end of your residency, what reflections do you have, advice, and thoughts?
Yeah, so I think if I start with the medical students, I didn't mention it at the beginning of my slide, but I kind of hinted at it. I remember vividly at UNMC, it was like our second day of onboarding, and one of the professors said, "If you have a hobby, lose it." And I remember that because I was like, "Oh God, what did I give up?" I don't know. And I was classmates actually with Dr. Foji. I don't know if you remember that day, but I definitely did. And so I would say, go ahead. What did you say? Yeah. There you go. But I would actually encourage you to figure out how you can funnel different interests and help them keep you human. I think this is a long journey, especially if you go into like a surgical subspecialty, and it takes a lot out of you, right? Whether it's family, sacrifice, friends, all these other things, and just having something that is important to you, whether it's music, running, exercising, things like that. Don't forget those things because it kind of goes back to like our core values at Creighton, right? It's like the whole person is what matters. For residents, all the juniors, you guys are great. I think we have an amazing program here, and I'm just super lucky that I've been able to work with all of you. And like to my senior class, I would not have been able to get through this without you guys. So thank you. And then just to all the faculty, thanks for everything you guys have done for us. Dr. Walters, I remember walking through the ICU, getting a phone call from a random number that I didn't know. I was a family medicine resident, and I picked it up and I was like, "Hello." He's like, "Hey, it's Dr. Walters." I was like, "Oh, hey, what's going on?" I thought it was like a patient thing, and that's when he told me that I was going to be coming to Creighton. I'm going to be a general surgery resident. So thank you to you again, and just everyone, Dr. Al5, for offering me the opportunity to stay here. I look forward to working with you guys and putting some good roots down in the ground in Omaha, Nebraska. So, yeah.
Let's give Dr. Lane a round of applause. Thank you.